AskReddit. Doctors, what's it like when you get sick? Do you go to the doctor or diagnose yourself? Part 1. I'm a dentist. I regularly tell my patients with TMJ issues how to alleviate their pain. Reduce stress, cut out caffeine, sleep in literally any position other than your stomach, stop chewing gum, hold your head, neck in a proper position, actually get a night guard and wear it. I've had TMJ pain on and off for 6 years. I do all of the things I tell my patients not to do. I do them every single day and often to excess. Long story short, I diagnose myself. I don't treat myself. Me to a patient. You should exercise more, lose weight, not drink, not eat greasy fatty foods, and should see the doctor regularly. Also me. I'm definitely going to McDonald's after work and washing it down with a six-pack. My friends' parents are GPs, and there are laws in the UK so you can't be formally diagnosed, etc. by family members. So as a kid, their parents would take them to the doctors like, they have this, and this, and the other doctor would just nod and prescribe medicine. Ha ha. There was a point I was awaiting to go in for an op, and it kept getting delayed, and then all of a sudden they called me and said the NHS would be paying for me to go to a Bupa hospital and have the op. I spoke to a friend that worked in the hospital I should have been having the op in originally and asked him if he could find out anything. Turns out the surgeon that was meant to be doing my op on the NHS had decided to do a favor for his girlfriend by doing an op on her daughter, and he made a mistake. But I was waiting on an op on my ear, so I'm guessing it was the same for her. Not sure the outcome of the mistake, but he got suspended while it was investigated, and a few of his patients that were waiting for ops got moved to private at the NHS expense. 10 out of 10 would want my NHS surgeon to do that again if it meant I got to go private without the cost. I am a urologist. Got testicular cancer during my chief residency year. I was shaving one day and just felt the lump down there. I immediately knew what it was and that it needed to come out immediately. Scary how fast it showed. One day it's a normal testicle, and the other, oh, there's a hard lump inside. The next day I walked into the ultrasound unit to get it confirmed and spoke to my boss who did the surgery the following day. Ironically, I had removed another patient's testicle for cancer just a week prior to that. I'm not a urologist, but once on a first date we were fooling around and I grabbed his junk and felt a lump. Told him it was probably nothing. I was 19 and had never felt cancer before, but that if it was something new to him, he should get it checked out. He made an appointment, went in, and I woke up to a call one morning saying he had cancer and had to get it removed. It was a pretty interesting occurrence. My friend, who's a doctor for a hospital, always diagnoses herself and will call out due to the fact that she doesn't want to get others sick. Her colleagues are almost always the same and completely understand the reasoning. I came from a family of doctors. I am a doctor, and I grew up knowing basically every doctor in my area. The best story I got is about a doctor we will call Graybo, perhaps one of the most senior and respected internal medicine doctors in my area. My dad is a workaholic. He loves medicine more than anything, and if he could do anything, it would likely be spending more time in the hospital. Me, not so much. Dad and Dr. Graybo were very similar in how much they loved their work. Dad and Graybo over the years became good friends and had sort of a direct and cynical humor they shared with each other. At one point, my dad cracked a joke at Graybo because he again showed up to work even though he was a bit sick. Dad asked, "Hey Gray, when do you think you are going to retire? You are getting pretty old and we don't want to have to pick you up off the floor here at some point." Graybo replied, "I'll never retire. Wait, yeah I will, when I die." Graybo never retired. A few years later, he was driving back home from an outing with his middle-aged son and started having a heart attack. While I assume he was experiencing the severe and horrible pain of a heart attack, he just looked over at his son and said, "I am sorry, I am having a heart attack." He passed away after pulling over. The man apologized to his son for having a heart attack that he was completely aware of. I can't say I would have handled that like he did. My pediatrician once told me an amusing story about when her daughter got sick. She brought her daughter into urgent care, among her coworkers, and was freaking out. Not sure what could be wrong with her daughter. Her coworkers looked at her and went, "You're a pediatrician." "I know, but I can't think straight." My mom's a nurse and has seen some horrible things. She almost passed out when I shattered my arm. It's definitely different when it's your kid. If anything, I'd want my medical team to be able to recognize when they're emotionally compromised and unable to make important decisions like diagnosis. I'm a veterinarian. When my own pet gets sick, I turn into a useless crying idiot. Luckily, I have good colleagues to turn to. I'm a vet tech. I was helping one of the doctors x-ray her rescue dog's chest due to a cough. I looked at the picture and pointed out she has a bullet in her side. She almost lost it right there. The saying, doctors make the worst patients, is true for a reason. Most of the doctors I work with, myself included, wouldn't hesitate to diagnose ourselves, and have on many occasions. Obviously, this comes with some bias, but I like to think that I'm able to tell the difference between A, this isn't serious and I can deal, versus B, maybe it's time to get a real workup. On that note, I have a particular antidote. My attending, lead doctor while I'm in residency, recently had an emergency appendectomy. He has a history of kidney stones and assumed that acute lower right quadrant pain was another one. By the time he realized maybe this is a situation B, his appendix had become gangrenous. Same principle applies in other industries too. When a stubborn sysadmin calls a vendor for help and gets told that the problem is definitely X, he'll usually reply with, "There's no way it's X." We've all got an internal battle between the need for help and the need to not need help. This may vary according to your country, but if I get sick, I can diagnose myself in the sense that I can say, yep, this is probably X. I should do this and take that test, or take this or that drug, but I cannot self-prescribe anything. I need another doctor to prescribe it for me. No pharmacy can accept a prescription with the same name for the doctor and the patient, and no clinic can accept a request for an exam. The only exception is for use in an emergency. In that case, I can self-prescribe. Doctors in Australia can self-prescribe, but the ones I have talked to about it say they won't self-prescribe anything that would be questioned, so no opiates or things like that. Married to a doctor. When I'm sick, it's man flu. When she's sick, it's the apocalypse. I have to force her to stay home from work sometimes when she's sick, but I have patients. Yeah, patients that don't need you coughing on them and making them sick. I thought man flu was the apocalypse, LOL. Man flu with diarrhea is the apocalypse. It is not fun to have fever, a blocked nose, and being forced to spend half the day on the crapper. I don't really go to the doctor except for annual checkups, labs. I do, however, self-prescribe things like eczema cream and asthma inhalers. A lot of this is driven by being a young resident. Thus, A, not really the demographic likely to have serious health issues, and B, not really having the time to go see a doctor due to my work schedule. Many of my peers have self-diagnosed themselves with appendicitis, small bowel obstructions, pneumonia, etc., and then presented to the ED though. I've also done the same for a lot of my friends over the phone. ER doctor here. 3 of my co-residents had appendicitis last year, 2 while on shift. One did his own ultrasound and wrote his H&P for the surgery team. The other kept himself NPO after midnight during an overnight shift, but kept seeing patients with IV running. 0 post-op precautions were followed. My father is a doc. He had been having shortness of breath and chest tightness worsening over a few months. One day after work was done and the clinic was closed, he hopped in the CT scanner and read his own CT scan. Massively enlarged lymph nodes all through his body, lymphoma. He's alive and well after diagnosing himself with cancer years ago. Good to hear. My mother has lymphoma and chemo didn't work, so now we are just hopelessly waiting for the end. Pharmacist here, and it seems several people have questioned if it is legal for doctors to write prescriptions for themselves. It is legal, at least in Illinois. It may not be in other states, but there are potentially ethical issues if it is for a controlled substance or for a type of medication that is outside their normal scope of practice. RI allows self-prescribing, but most pharmacists I know choose to fill only non-controls for self-prescribing. I haven't met anyone who does differently. My ex is a doctor, and this subject came up. He was terrified that he had some kind of low-symptom cancer like lymphoma or an autoimmune issue, but he didn't want to actually get it seen about. The idea of treatment was worse to him. The knowledge of exactly what was needed to find out apparently was not comforting. Not only that, but sometimes seeing all the steps that are involved in treatment can hit you up bad. Like, if you're experiencing symptoms but not a whole lot, That sounds far better than dealing with the realities of chemo and/or radiation that we see every day. I work in medicine too, though I'm not a doctor, and I totally get that feel. Doesn't hurt that my mom also had no symptoms of lymphoma, felt fine, found out and then had to deal with 2 major brutal surgeries to get rid of it. I'm a resident. I had a doctor's appointment and I let my attending know a week in advance. He chewed me out over email and CC'd my program director, saying that I obviously didn't take the rotation seriously. My PD was pissed. They had my back and told me to go to the appointment. The attending emailed me the next day with a forced apology. Good on your PD. That reaction is my nightmare. Wife is a surgeon. Some magic happens as soon as she's on call. No longer sick, 100% fine, then gets sick again after her shift. It has to do with some weird space-time vortex, I believe. I'm no doctor, but I feel tired, weak, and short of breath on weekends, only to be magically cured on Monday. Allergy to family, maybe. Not in the specific spirit of the question, but when I'm talking to my patients about code status, full code is CPR, ventilator if needed, versus DNR, DNI. And they ask me what I would do. I always tell them that doctors statistically opt for far fewer heroic end-of-life measures than non-medical folks. Like was said in the other comments, little stuff is no big deal, but it seems like as a group we're less aggressive in seeking care. I feel like this comes down to the fact that doctors often see exactly what heroic measures entails. That in the end, it's not a nice way to go. Even if you survive, it doesn't mean your quality of life is worth the debilitation you might now have. I survey my symptoms and list them, as if a patient were complaining about them to me. If I don't identify any immediate concerning red flags, I treat the symptoms myself, seeing a doc if I truly need ABX, steroids, etc., and reassess about 1 week later if not totally improved. I do have a lymph node, a few moles, and a weird lump I feel occasionally under my stomach under chronic scrutiny. When you work in medicine and go to the ER, you will have hell to pay if it's not for a legit reason. I would sooner suture myself if possible than go to an ER and let them see me bleed. Truth be told, sometimes I think about faking the right symptoms to my PCP to get a total body MRI, laugh my ass off. I totally understand this. I'm a coder and was having serious dizziness for a prolonged time and saw my PCP about it. Knowing the dizziness DX code wouldn't get an MRI paid, I told him I was having headaches as my primary DX. My MRI paid, and thankfully there were no tumors or anything. Also, I code for trauma docs, and the stuff they see in the ER could easily have been taken care of outside of a hospital. I have to be on my literal deathbed to end up at the ER.